Hello, my name is Zach Norch, and today we are talking about elephantitis. And what that is it is a severe swelling of an area or appendage within the body. This can be multiple areas, arm, legs. In more severe cases, it can pertain to the genitalia region. So that's what we're going to be learning about. Now, so what the cause of elephantitis is based off of lymph. And the lymph is a part of the immune system which flows through the blood vessels. And its job is to find the pathogens within the body and dispose of them. Okay? And they do this by going throughout the body, working with the blood system, and attaching the pathogens to themselves, and then going ahead and taking them to the lymph nodes, which discard them. Now, the issue is with elephantitis, the pathogen has somehow gotten into the lymph vessel, and at this point, it begins to clog it. So like a beaver with a dam would clog a river and make a pond, it's the same deal. So it clogs it up, and then the lymph begins to spread and swell within that area, thus creating that severe swelling that we were talking about. Now, there's a few things that cause this, but the main thing that is going to cause this sort of swelling is a parasitic worm, or rather 3 different types of a parasitic worm. And these are contracted via mosquito bites. And what's going to happen is, it's very similar to the vector of malaria or something like that. The mosquito is going to have larvae of the parasitic worm in its mouth, per se, and it is going to come up to the human host. It's going to bite the arm, leg, wherever, and whenever it does that, attempting to get blood for food, it is going to inject the larva into the blood. And like we said, the lymph does deal with the blood of a human, and so the parasite will then go until it finds a lymph vessel, at which point it will begin to take in nutrients and grow, and as it grows, it develops the stoppage in lymph, or in the lymph vessel, thus creating the swelling. Now, a couple other things that can cause this are some very few bacteria, but outside of that is if you're walking, if you're doing something like that and you don't have shoes on, the soil has minerals in it which can go into your body, at which point your body will absorb that, and the swelling can occur from the minerals that are absorbed. This is a much rarer form. It does occur, but the main form you're going to see is through the parasitic worms. As far as the types of people you will see this issue in, it's not really based off of gender or age. Generally, the same type of people are going to see it. The difference in where you're going to see this is based on the healthcare system in that area, in which case underdeveloped third world countries are going to have the most issue with this virus. And the reason for that is pretty obvious. Just with more developed countries, thus have better treatment, their people tend to be better taken care of, things like that. Obviously with shoes and things like that, the majority of people staying in the United States are going to have shoes, things like that, whereas in an underdeveloped country, somewhere in Africa, they may not all have that. It's going to be more difficult. So underdeveloped areas are where you're going to see this most heavily. So as far as cures go, there's a few different cures. The main type you're going to see throughout the world in those underdeveloped areas are mectizan and albendazole. And mectizan, it will go in, it hyperchlorizes the area by opening up the chlorine channels, thus killing the parasite within the host. Now, albendazole is a little different. It's going to attack the parasite directly. And what that is going to do This is going to go in, it's going to attack the coccine channels within the parasite and then begin to degenerate the intestinal cells within the individual parasite to kill it and get rid of it. Beyond that, there's this other one which you will see more in the US. It is called diethylcarbamine. And what that is, the difference between that and the other two is it is a stronger sort of drug. So whenever you get that stronger drug, it's going to act quicker, but it's also going to create more side effects. So in the US, steroids and anti-inflammatories are usually given with that. Whenever that happens, it takes away those side effects, but as you can imagine, within third world countries, having not only the drug, but also steroids, also anti-inflammatories, obviously increases the cost and is going to be more difficult for people to get. So that's why those top two are focused on that. They don't have as much need for cofactors in their drugs, basically. Surgery is sometimes needed. It depends on how severe it is. So once the parasite is killed or other medication, if necessary, is given, there's still the swelling. And if just removing the parasite does not reduce the swelling, then what you're going to have to do is go in, have a surgeon remove the extra tissue, and allow for people to remove that extra tissue and fluid within their body. One for cosmetic purposes, two for just functional so that the lymph flows readily again. One of the most important things, and probably even more important than treating it, is finding a way to prevent this in other countries. Now, obviously, as I stated earlier, it's going to be difficult to prevent because they just don't have as much money, they don't have as much funds to put towards this. Clothing is obviously an issue, bug repellent is obviously an issue, shoes are obviously an issue to let it in. They just don't have the same amount of funds. Even getting the treatment drugs there, it takes a lot of donating from other countries. So if you're planning on going to one of these areas, if you're susceptible to this, some of the best things you can do is, one, just wear proper clothing, pants, long sleeve shirts, even short sleeve shirts, just something to cover your body to give yourself that little extra protection. Beyond that is a big part of shoes. Like I said, you can develop this through minerals in the soil. If you're in that area, you want to be protected from that. And beyond that, you really want to have some closed-toed shoes just to protect yourself from bug bites down near the ankle area. It's not having closed-toed shoes is not going to somehow allow the minerals into your feet, but it does help with the bug bites. Finally, the biggest thing you can probably do is have some sort of insect repellent. And if you have that insect repellent, it's going to keep the mosquitoes, which is the main vector, away from you. So with these things, you're going to be able to stay pretty safe in these areas. There are treatments for it. However, obviously, if you come into contact with this, it can be a very difficult health issue, and you need to get it treated as soon as possible. So thank you very much.